I'm going to go live when I'm up.
What's that now?
You're going to go live when I'm up there.
Okay. Is that straight? Okay. Are we live? We're live. Thank you, Gina.
You're welcome. Fun.
Thanks. Well, hello and welcome. I'm Dr. Steve Petteruti on behalf of the Drip Bar and Intellectual Medicine. We're here to have our usual Wednesday at noon chat time as Gina's getting the podcast kind of squared away. We are live there too. Very cool.
Yay.
Now, Gina, if they want to send a question in, how do they do that?
Facebook.
And can you see it in real time?
Yes, I can. I'll be paying attention to it.
Okay, so if you guys want to send a question or a comment, do it on Facebook. Can they do it on the YouTube? They can't, can they? We'll work on that. How about if they went to our website and posed a question there?
It's better to do Facebook, but if they do it through our website, it takes a while.
Okay. All right, we'll work on that for you, team. Because
Well,
I don't have a Facebook account, so I know some of you may not be in Facebook world. So we're talking about medicine, about anti-aging, and really our focus lately has been discussing immune function, and we're going to touch on that today. We'll talk about what is your greatest risk factor. What is one of the, if not the, greatest risk factor for complications such as death or intubation from the COVID-19, Wuhan virus, China virus, I don't know what to call it. So COVID-19 is the disease caused by the coronavirus, which is yet to be named. So it's like a baby waiting to be like labeled. I don't know that we can call it coronavirus. It's not specific enough. The common cold is caused by a variety of the coronavirus. So really we need something new and different. Now calling it the China virus or the Wuhan has become a bit of a flashpoint for some people. It's very much inclined to obliterate and affect, obliterate's kind of too aggressive a word, but to affect people in nursing homes. Maybe it's the nursing home virus. I don't know. Be a topic to offer suggestions. What should we label this virus? The pandemic virus? How about if we gave it a year? We could call it Corona 20, indicative of this year, Corona 2020. I guess that's a takeoff on the disease, Corona 19. Anyhow, what can you do? How do you survive it? What are the factors? What's that risk factor? And really what we have happening, folks, is a simultaneous collision of two epidemics that have manifested in such a horrible consequence, particularly in America. I mean, why is the death rate in the United States so high when in fact we have a highly developed nation with a wonderful infrastructure of healthcare, hospitals, doctors, specialists, really nobody better than us of all the nations that have been afflicted, as much as we can all acknowledge that we could have been better prepared, that we could have had supplies in reserve. Compared to other nations, we were as well prepared as any. When you look at the information that's building, and let's comment on that for a moment. It is a very difficult topic to be certain with regarding anything that is said. What its cause is, where it came from, what the symptoms are, what the death rate is. It seems to us, in fact, doesn't seem to us, in fact, the information is changing, like sometimes daily. And that undermines our confidence. When I hear people say, we're going to let the science make this decision for us, you can't. It's not good enough. And it's too value laden. Science and scientists and specialists and immunologists and epidemiologists cannot make the important decisions we need to make because we're talking about too many variables. Everybody wants to be safe. The next question, define safety. Does safety to you mean I will do anything to diminish the risk of acquiring an infection? Or does safety to you mean I will do anything to preserve my quality of life, including my income, my livelihood, my ability to feed my family? They both are a form of safety. What do we value? Freedom. Do we value liberty, or do we value authority to direct our behavior with the hope of an outcome? If there's a conclusive path to walk, it makes sense to walk it. In the absence of that, it's incumbent upon our leaders and the public at large to reflect. The right person to make this decision, actually, I think, is the politicians, because they have to weigh all the variables. The epidemiologists remind me of the economist. An epidemiologist trying to predict what will happen next with regard to the virus is like an economist trying to predict the stock market. They both have an aura of authority, and they both are kind of doing an educated guess. Initially, the death rate was supposed to hit 1 million. It's been re-engineered downward, which means if it's re-engineered downward, were they right when they said 1 million? And did our behavior affect that? Or are we simply seeing the disease manifest itself as it otherwise would have? In other words, suppose we did nothing, would the outcome be much different? We'll never know, because we chose to take actions to try to prevent its propagation. So think about that for a minute. Here we are in the year 2020, and we're addressing this pandemic in a similar fashion how they did in 1400. We're running and hiding because we're afraid of the immune hitting us, not the immune, the virus hitting us. We're going to have to learn to live with this. It's not going away. There will not be an immunization that anybody feels confident with for 5 years. Why do I say that? So the day they come up with an immunization, are you going to get lined to have it injected in you? If you're young and healthy, imagine you're 28, to be 28, but imagine you're 28, you feel great, you're in top health. Your risk of getting dead or severely ill from this is incredibly small, unless you're otherwise ill. So why should you risk an untested immunization? Are they going to mandate it? And if so, will it make a difference? So I recall several years back, the flu spray. You guys remember that? It's a spray, it was a nasal spray. That nasal flu spray was touted as being a breakthrough. It's going to work better. It's not going to need a shot, so more people will get it. About 3 years after it had been introduced to the market, they concluded it didn't work. It wasn't helping. It's disturbing because it came in with such hope and science behind it. In reality, every immunization upon its creation becomes an experiment that needs to be monitored. Will it work? Only time tells. You can't tell from a study, only by putting it in the population. Will it cause side effects? What if those side effects are delayed 5 years? You need time. Will it have sustainable effect if in fact it works at all? That will require years of monitoring. So my point is this: the immunization isn't coming over the hill to save us, nor is a treatment. You may have heard or read about the recent study that had a negative outcome with hydroxychloroquine and azithromycin. And this is the remedy that has been touted by President Trump as being a possible game changer. I mean, who's right? The study that said it didn't work, or Donald Trump in the original study that showed benefit? It's possible they're both right. And here's how. Early on, it seems this virus replicates, creating the illness. As it gets deeper and you become near to death and the lungs fill with gunk, the virus itself is less of a factor, it appears, and it's more the result of the inflammation the virus created. So if the inflammation is the problem, giving a drug that kills a virus is no longer the solution. Therefore, it's possible that this approach may have merit early on, but not when it's become severe. Studies need to be done to verify or validate that. Here's what we know today. There is no treatment known to cure or help in the face of COVID-19. That's uncomfortable. So what can we do? Well, we can do things to help us, right? We're the American people, for gosh sakes, right? We innovate, we create, When others say you can't, we say you can. When there's a no, we say let's make it a yes. When they say the economy will crash, we say let's build a new one. We can't wait. A $1,200 check is not the solution to anybody's problem. It's a brief interlude. It can't be sustainable. We have to get moving. We, the American people. If you're sitting on the sidelines, think about how you can get back in the game now. Politicians are great at carving up the pie. They're not brilliant innovators in most cases, creating new businesses. That's our job. Our job is to think about the hand we've been dealt, and how we're going to manage that. So step one, let's not sit and huddle and wait in fear. Let's start rebuilding this economy now, the best way we can with what's available. This isn't going away. We will have to learn to live with this virus. We will have to beef up our hospitals. It's being done. We have to stop looking at the daily death rate like it's the Vietnam War and we're doing a body count. I encourage people to no longer look. So we're told not to look at this day by day because it's going to be disturbing us. And what do? They give us a daily report, right? I'm advocating we just shut it down and once a week, give us a summary. Otherwise, everybody's like, how many people died today? It doesn't reflect the direction we're moving in. People dying today had maybe got hit by it 2 weeks ago. There will be deaths for the foreseeable future from this virus. So what can we do? Treatments are underway. We're looking at Sweden. In Sweden, they've chosen to leave restaurants and other businesses open and do a modified form of social distancing. They consider that more sustainable. So far, they're having a better outcome than Italy, which went on lockdown. The state of Georgia is liberating their lockdown. We need to learn from that. It's a living experiment. Are they right? Are we right? Nobody knows. Maybe they're both right, and maybe they're both responding to a different perception of safety, like we spoke of earlier. What can you do today, right now? There are several things I recommend. None of these are FDA approved. None of these are proven to work. They're based upon the physiology that seems to be behind some of these entities. They're based upon what we know about how your immune system works and things you can do to keep it on its top level. Let's presume that we're all going to come in contact with the virus, 100%. What saves us in that moment is our immune system. That's why old people are dying, because their immune system is weakened. That's why half of the people, according to a recent report, who died from the COVID-19, half of them had high blood pressure and were obese. They had that combination of risk factor. 50% of the deaths, hypertension with obesity. Wow, that's a huge statistic. One epidemic is the obesity epidemic that has been growing, that has been affecting the health of the nation for decades. The other epidemic, now layered on top of that, COVID-19. It may not be an accident that we're getting hit so hard. We are, after all, the fattest, if not one of the most obese nations in the world. We have to start looking at this epidemic of obesity sincerely. At Intellectual Medicine, we take this seriously as a medical condition. We have adapted to the coronavirus. We now have online weight loss group treatments that we can implement. So that's an option to try to work on one of those risk factors. One of those risk factors being obesity, percent body fat, waist circumference. Why? It appears, and this is according to Melinda Beck, she's a researcher at North Carolina Chapel Hill, who said, and I quote, immune cells don't function as well, end quote, in obese people. There's something about the obesity itself that damages the response of the immune system. That may be why obesity is a risk factor for breast, prostate, lung. There are doctors that specialize in it. I'm one of them, not the only. Other doctors you can look for. If you look at the Obesity Association, there are board-certified obesity specialists out there who can serve you with science and can serve you with medical treatment to support your nutritional change to help you reduce your weight level. So that's one thing you can do while you're shuttered in. Think about your immune system and then think about percent body fat. What else can you do? Well, one of the most common causes of immunodeficiency, this is according to Dr. Tapiro in his journal article from 2003, and he states the most common cause of secondary immunodeficiency states in humans is zinc deficiency. Zinc deficiency, because zinc is the only natural substance known to stimulate division and reproduction of the immune cells. So if you don't have enough zinc in your system, your immune system may not be working properly. And you can't tell. You don't get up in the morning and go, gee, I think my zinc's low. I think my immune system's a bit off. You can kind of tell what the risk factors are, right? Drinking too much, not sleeping, that'll knock you down a peg. Do not bump into this virus the day after you had a six-pack for dinner. You're going to be at risk. If you're otherwise ill, if you have a chest cold, a head cold, your immune system is knocked down a peg. It's like fighting a two-front war. That's another good reason to withdraw right into social distance. So zinc supplementation may have merit. We now are offering the Shield at Drip Bar, which is an intravenous infusion of zinc, vitamin C, magnesium. Why? Because those are critical micronutrients supporting immune function. Are they going to cure COVID-19? The answer is no. There's no known cure. They're not infusion-based health support, cell life. Acknowledging that health starts at a cellular level that we can't see, we can't always feel, but it drives our health. So the theory is if we give this infusion, and we're recommending that you consider doing it about every 2 weeks from now till the end of May, hopefully things settle. By virtue of giving this infusion, we're hoping it will support your immune function. So when you bump into the virus, it's working at its top level. It's an unproven theory that's based upon what we know about the immune system and the micronutrients that we know support it. There are clinical studies showing a connection between implementing zinc and vitamin C early in the course of a viral illness that has been shown to reduce its rate. In a study looking at zinc and vitamin C, the duration of upper respiratory infection, the common cold, 4.9 days with supplement, 6.1 without. It doesn't seem like a lot, but if you're suffering, a day and a half, 2 days, that matters. Another caveat, better started early. Like most interventions with the virus, if you're taking acyclovir for a cold sore, you already know this. If you start it right away, day one, it's going to help. You start it 3 days later, it's no good anymore. The virus is taken over. So shoot first, start early. At Drip Bar, we are gearing up. It's our responsibility. We are the front line. We are the doctors. We can't run and hide. So I had a couple of cases this week reminding us that there's more out there than COVID-19. A patient going through withdrawal from opioids, seeking treatment, seeking care. You can't just shut the door to people. Telling folks to stay home if they have a fever and a cough is, in my view, not the best path anymore. Maybe we had to do that early on, but we're figuring things out now. If you're staying home with a cough and a fever, how do you know it's not bacterial pneumonia? How do you know it's not an asthmatic flare that requires medical treatment? If it is COVID-19, is your best play to just sweat it out? I mean, it might be. We don't know the answer to that question. But the alternative that we're offering at Drip Bar, now we have the ability to do the nasal culture. So people coming in, if you call first, we have isolation rooms. Will wearing the mask help? I'm not sure, but wear it. It's been asked of us, and if we comply, it'll do no harm. and we can wear that mask, make the people around us feel better, if not actually affecting the curve. So the nasal culture, yes. So what we're advocating is when you feel an early symptom, get a culture. We encourage consideration of the infusion, the shield, supporting immune function, as long as you and we both acknowledge it's not an FDA-approved treatment and it's not known to cure the COVID-19. And we don't know if it's going to actually reduce the rate of complications. We do have a cluster of clients that are coming in every couple of weeks, and they're doing the shield with the hope of keeping the immune system strong so that they don't get sick. It's a small cluster. Thus far, their infection rate is less than 1%. In fact, there hasn't been one yet, but it's not a scientifically valid study. We're just observing, called a cohort observation, and watching to see. Hopefully, this will help inform our decisions moving forward. Another option, this is very exciting, available today, we can start doing blood testing for antibodies against COVID-19. A blood test is sent to the lab where they can do an IgG and IgM test to determine if you've been exposed. Bear in mind, exposure, if your blood test is positive, doesn't mean you can transmit the disease. You can only transmit the disease if you're shedding virus. That's the nasal swab, shedding virus. You can shed virus without being sick. You can have encountered the virus without ever getting COVID-19. COVID-19 is a diagnosis based upon symptoms and the presence of the virus. You can't have presence of the virus without symptom. That's the silent shedders. It doesn't mean you ever had the disease. It means that your immune system built it before it could do anything to you. How cool is that? Well, if you're young and healthy, you got that going for you. If you're a little older, 61 now, I'm doing my infusion because I believe it has value to me. So we talked a little bit about obesity and its connection to the COVID-19. When I talk about immune function, you can extend that reflective conversation to include a cornerstone element of anti-aging health support, an emerging field of health support based on the science of aging, looking at why we age, what are the consequences of aging, and what can we do about those. And one of those consequences is zinc-induced immunodeficiency. Looking for the study. Here it is. Studies showed immune recovery in elderly people and in those who had infections when given zinc as a supplement. Now, bear in mind, folks, you can't just take zinc ad nauseum. There is such a thing as too much. The right dose helps enhance immune function. Too much can compromise immune function. So the dose matters. It's generally recommended and generally considered to be safe to be at about 15 milligrams per day. Make sure, if you're contemplating that your doctor knows what you're taking, and that you look at all your supplements, because sometimes zinc is hidden within other supplements, so the total needs to be added up. We like the high dose infusion for a finite period. We also have designed the immune support supplement box, which is a 30-day supply of zinc, beta-glucan, and a green tea extract. Perhaps at another time we'll discuss the science behind these. Suffice it to say in the moment, the beta-glucans have over 6,000 publications behind them about their possible benefit to immune function, but they're not all the same. So if you're contemplating it, don't run out to GNC or to a supplement store and buy a generic beta-glucan. It may not work. You want to chat with somebody who knows about this type of thing. Many doctors have now taken it upon themselves to acquire this knowledge. At Intellectual Medicine and the Drip Bar, we make it our business to stay informed about this type of support. Naturopaths and chiropractors, DOs and MDs, depending on their interest, may acquire that as well. So to those who say supplements have no value, to those who say more zinc is better, I say the studies beg to differ. So we all get to make our own choices philosophically about how we want to move through this crisis. Gradually, we're going to adapt because it's what we do. The virus will not go away for people that are either chronically ill or people that are advanced in age. A good immune system, foundational to all of that. At the Drip Bar, we make it our business to help research and implement and put and make available to you. By the way, you don't need a doctor's appointment, a referral, or a prescription. These supplements are available with a health questionnaire screening to most everybody. They are not medicine. They don't treat disease. This is cellular health support. So on behalf of the Drip Bar, I'm going to leave you one more question, though. And you guys can respond with your own answer to this. I'm just curious. Key and essential businesses are being kept open. So I was riding my bike into work today. It's what I use for transportation sometimes. And it's not changing gears so good. And it occurred to me that a bicycle shop I consider key and essential. It's how I locomote. What do you consider key and essential? Liquor stores are open. Marijuana shops are open. I don't know. It's a value-based judgment. It can't be based simply upon the number of people in a given space. In France, pastry shops are key and essential, value-based. Anyhow, I am glad you tuned in. Next week, perhaps next week, we're going to talk about sexual functioning as regarding anti-aging and maintaining vital health. I mean, we're all locked in, got to do something. And it's part of the science and the medicine of anti-aging. It is part of our vital functions that we shouldn't simply sacrifice by virtue of chronologic lifespan, much like our immune system. On behalf of the Drip Bar and Intellectual Medicine, I'm Dr. Steve Petteruti. Thanks everybody for tuning in. Good luck out there. Stay safe. Wash your hands. Wear your mask. And keep 6 feet away. Take care. And that. I think I can do that. Here we go.